again. Welcome to CF Sinus Disease, the research overview. My name is Eliza Callard, and I will be your moderator today when I remember to put mute off. First, I'm just going to do a couple of housekeeping notes. One is that this event is being recorded, and it will be posted on YouTube. Everyone watching tonight will receive an email with a link to the recording. We will have time at the end to take your questions live. So type your questions at any time into the Q&A box, not the chat, but the Q&A box. We won't be able to answer questions about anybody's individual diagnoses or treatment plans or the mole on your back, but we encourage you to use the information you use today to have conversations with your care team. And if you use the event chat, change it to all panelists and attendees so that everyone can see your comments. The default is to just the three of us. Closed captioning is available. I hope I'm speaking slow enough so that you can hear the subtitles. You can turn them on and off by clicking the closed caption icon at the bottom of your screen. And for those of us with hearing aids, it is always appreciated. Okay, so welcome. Tonight we will be having Dr. Anna Zemke and Dr. Daniel Beswick speaking to us about the different I like that, about the different studies they've been working on with sinus disease in CF. I will leave the science to the scientists, but I wanted to start you off with a little of my own story. So I'm 47 and I have CF. I was diagnosed a couple of days after birth due to meconium ileus. And then at 12 or 13, my lungs got colonized with bacteria, Pseudomonas aeruginosa, and soon after I started having chronic sinus problems. I've had 13 sinus surgeries since '88. And I feel like I've watched the evolution of this procedure. The last one I had was in 2018. At the beginning of my journey with sinus issues, surgery was ugly. I had to stay overnight in the wards at the old St. Christopher's in Philadelphia. And in the morning after the surgery, this guy came and pulled like 1,000 yards of disgusting bloody gauze out of my nose, just hand over hand, almost making my older brother pass out. In high school and college, surgery was a regular feature of my life. Although the packing stopped being gauze and started involving a thing that looked a little like a tampon, where they pulled this pinky-sized hard cotton thing out of my nose and made it feel like I was a champagne bottle. But eventually became a dissolvable gel that I never even saw. Over time, the number of my surgeries slowed up. I was having them every year for a little while, and it became every 2 years, every 3 years. 3 years ago, I had major surgery in which they had to drill holes into the bones around my eyes to open up sinus cavities that had been sealed, been lost for decades. A month after that surgery, I got on the study for Trikafta. And I haven't had a sinus surgery since. My surgeon couldn't believe his eyes at the 6 month, at the year, how good my sinuses looked. He said, usually CF sinuses, it just comes right back. So it's important to remember that my story is not everybody's story. Some people have had worse, some people have had better. So it's time we talked about the sinuses and the possibilities post-modulators. So here we go. First is Anna Zemke, who's an assistant professor of medicine in the pulmonary division of the University of Pittsburgh. She is a CF researcher with an interest in microbiology and CF sinus disease. Good to have someone like that around. Anna?
Thank you. Next slide, please. So I'm going to give a little background about CF sinus disease and then talk about a study that we've done at Pitt and UNC. So first of all, CF in the sinuses. It's very, very common. 100% of adults and nearly all children with CF have sinus disease on imaging like CT scans, but only about half of people report symptoms for their sinus disease. Go to the next slide, please. So before we talk about the sinuses, we're going to talk briefly about the lungs. And most people in the audience are very, very familiar with the lung part. In people without CF, the airways are usually covered with a thin layer of fluid that can attract bacteria and dust, anything that you inhale, and then ciliated cells sweep it up and out of your lungs into your mouth where you can swallow it, and it helps keep the lungs clear of inhaled debris or infectious bacteria. Proceed. In CF, this mucus layer gets thick and sticky, and when bacteria and dust fall on it, it isn't swept up and out of the lungs as rapidly as it should be or as well as it should be, and you end up with chronic bacterial infections in the lungs and remodeling of the airways. On to the next slide. So the sinuses are spaces within your skull and face. On the right hand is actually a CT scan of somebody after being on Trikafta for 6 months. And these black cavities are full of air. This scan was taken on a plane that runs through about like this, through the middle of the person's eyes. And this cavity is complicated. It's got a lot of different nooks and crannies in it. And usually it's covered with a thin layer of mucus that performs a similar function like the mucus in the lung in terms of trapping debris and moving it up and out of the sinonasal cavity and down into the back of the throat. In health, there's bacteria living in it that are commensal, meaning they mind their own business and don't cause disease. And another important thing to know about the sinus cavities in health is the holes draining the sinus cavity into the back of the throat are very small. So it's pretty easy for them to get blocked if there's any problems. On to the next half of the slide. So in CF, mucus is thick, it accumulates in the sinuses. It has trouble draining through the holes to drain out of the sinuses. Bacteria set up shop and you end up with chronic bacterial infections in the sinuses. To help the sinuses drain, it's really common to get surgeries. One of the names of the surgeries is an ethmoidectomy. And the inside of the nose gets all inflamed. You also have polyp formation. The picture on the right is the same person on top, but before starting on Trikafta. And that sinus cavity in the middle with the red circle around it is full of mucus there. You can see it's opacified. On to the next slide. So what symptoms does sinus disease cause in CF? Facial pain, pressure, headaches, nasal discharge, blocked nose, being just really stuffed up here. And then a lot of people lose the ability to smell or it's decreased. The scientific name for that is anosmia. And that's important because it impacts your quality of life. Sometimes it's a safety thing, some things you need to smell as safety signals, and it affects your nutritional status in some people. Over years and years of these infections, the bones in your sinuses and face can get remodeled or change shape. And interestingly, many people with CF have sinuses that are smaller than those seen in people without CF. The medical name for this is sinus hypoplasia, or sometimes missing altogether, sinus aplasia. Occasionally, people can have very severe infections that cause other complications. And potentially, sinus disease can worsen lung disease or pulmonary exacerbations, which I'll talk about in a couple slides. On to the next slide. For many people with CF, this is just another burden. It involves surgeries and all the trouble that entails, more doctor's appointments, and having sinus medication rinses that are time-consuming that you have to do every day to keep your sinuses healthy for many people. On to the next slide. So there's a hypothesis in pulmonary and lung research called the unified airway hypothesis. And what this is that Your lungs, your large airways in your neck, and your sinonasal cavity are all one biologic unit. And the disease in one can influence disease in the other. In CF, there's ongoing research. So a lot of what I'm going to say has research to support it, but we don't know that it's 100% true. But we have ideas of what's going on here. We think that the sinuses are colonized very, very early in life with bacteria in individuals with CF. And the bacteria that live in your sinuses can drain down the back of your throat and potentially infect your lungs. And the way we know that is because after lung transplant, genetically identical bacteria are found in both the sinuses and in the new lung allografts, suggesting that the bacteria down in the new lungs came from the person's sinuses. We also have data that if your sinus disease flares up, that you're more likely to have a flare up in your lung disease, a pulmonary exacerbation within the next period of time. So this is an ongoing area of research for a number of researchers funded by CFF to try and figure out how the sinuses interact with the lungs. On to the next slide. So our question for our study, how does, I'm only going to say this one once, elexacaftor, tezacaftor, ivacaftor, hereafter called Trikafta, change CF sinus disease symptoms in the microbiome? On to the next slide. So we wanted to do a study that would enroll 44 people, age 12 and older, so this includes teenagers. And we had two sites, University of Pittsburgh and University of North Carolina. And we wanted to determine the effect of Trikafta on CF sinus disease in the sinus microbiome. So our study design was as follows. Before starting Trikafta, people came in for a study visit where they had an endoscopy, a sweat chloride test. They did PFTs and had their height and weight measured, did an olfaction test. And when they did the endoscopy, we collected swabs to study the microbiome or the bacteria living in the nose. After being on therapy for 6 months, we did the same visit again, exact same procedure. In between the two visits, people filled out a SNOT-22 symptom scale by email that reported symptoms they were having related to their sinonasal health. On to the next slide. So then COVID happened. And so our follow-up visits were a median of 9 months with a range of 6 to 12 months. And instead of 44 participants, we recruited 34 and had 28 people who did both visits. On to the next slide. So who is in this study? We had a little more than half of the participants were male. A third of the participants were teenagers between 12 and 18 years old. And then adults 18 to 60. We had people up to age 60 with a median age of 27 years. About 2/3 of individuals were F508 del homozygous, and about 60% were previously on other modulators before Trikafta. On to the next slide. So first question, did Trikafta help sinus symptoms? Participants filled out a SNOT-22 scale, Sinonasal Outcome Test 22. I did not name that, but it's still a lot of fun, even after several years of doing this research. And questions on the scale include things like, do you need to blow your nose, nasal congestion, runny nose, postnasal discharge, facial pressure, sweet quality, and then a number of other items, 22 total. Next slide. And so a higher score is more symptoms. And what we saw was before treatment, people were scoring about 25, and within 7 days, they reported an improvement in sinus symptoms. And from day 28 out to day 180, we saw a sustained improvement in sinus symptoms. Most of the improvement you can see on this graph, the sinus symptoms are on the vertical axis, the time is on the horizontal axis. Most of the improvement happened within the first month, but it persisted out to 6 months. Next slide. So in CF, sinus symptoms don't always correlate very well with how severe the anatomic disease is. So we also did nasal endoscopies and CT scans. A nasal endoscopy is where they numb up the inside of your nose with a spray and then stick a camera inside to look around and take pictures. Through this camera, they can also put in instruments to treat things in your nose or to get samples. And on the next slide, I've got some endoscopy pictures which have nose boogers and a polyp, so be warned. On to the next slide. So the endoscopy findings really improved for most of our participants over 6 months. On the left side, A, C, and E are before pictures. And on the top one, you can see there's some thick yellow drainage. In C, there's a polyp, which is that kind of glistening ball at the top of the frame. And the inside of people's noses was really red and angry looking. And after treatment, there was much less drainage, there was much less swelling. And for most people, the polyps improved or disappeared. Next slide. We also wanted to know, does the sense of smell improve? So we measured olfaction, which is the ability to smell, using a scratch and sniff card before and after starting Trikafta. So this test has got about 40 items that you scratch and sniff. Some of them are food, some of them are a variety of other odors that one might encounter out in the world. On to the next slide. And surprisingly, olfaction didn't improve on Trikafta. On the left side of the screen, in blue are people's scores before starting the drug, in yellows afterwards. And if it looks like a cloud about the same, or some go up and some go down, statistically, that's what it turned out to be. There was no significant improvement in the ability to smell after 6 months of Trikafta. On the right side is the same data displayed a little bit differently. So the test comes with a reference of what the distribution of results is if you just take, 1,000 random people off the street. In blue are the people with CF before Trikafta, yellows after Trikafta, and gray is the reference. And many people in the study had decreased ability to smell, so the normosmia bars are much smaller, and they really didn't get any bigger after Trikafta. At the very bottom are people that had no real ability to smell, and those bars stayed about the same after Trikafta. On to the next slide. So in summary for this study, sinus symptoms improved within a month of starting Trikafta, and the improvement stayed out to 6 months. Nasal endoscopy improved dramatically. Surprisingly, the sense of smell did not improve. And we're in the process of studying whether the sinus microbiome also improves, but that data is not analyzed yet because the samples are still off getting sequenced. And at this point, we have a study enrolling kids aged 6 to 12 at University of Pittsburgh and University of North Carolina who are going to be starting Trikafta. And that study's got a similar but simpler design that'll be easier to do with grade school kids. On to the next slide. So there's still lots of questions that this study does not answer that I think are interesting and important. Some of them are important. So a few people didn't have much improvement in their CT scans or endoscopies, despite having improvement in their sweat chloride levels. And we don't understand why there was a small subgroup of people that really didn't have as big of an improvement in symptoms or in objective findings on their CT scans or endoscopies, despite having a biochemical response or an improvement in sweat chloride on Trikafta. Second, we don't understand the role of allergic rhinitis in the setting of CF sinus disease on Trikafta. Presumably after treatment settles in, there may be residual sinus disease, but we don't know what it's going to act like yet. And we don't know the role of seasonal allergies in that. The study doesn't answer, will treating sinus disease improve lung function after transplant, either for people on Trikafta or off Trikafta. And the study also doesn't answer what are the most helpful drugs to put in nasal rinses. And on to the next slide. And with that, I'd genuinely like to thank everybody that helped with this study. First of all, the participants and the families of participants. A special thanks because we were working through COVID with some of these study visits. I really appreciate, and the whole team appreciates your time and effort on the study. We'd like to thank the Cystic Fibrosis Foundation, and this involved a large study team at 2 sites. Adam Kimple, Brent Sr., Amanda Stapleton, and Stella Lee were our main ENT doctors on the study, as well as coordinators and then other research scientists that helped with the study. And with that, I'd like to turn things over to Dan Beswick. He is a rhinologist, which is an ENT doctor who focuses on sinus disease, and an assistant professor at UCLA. He's an outcome researcher and focuses his work on CF research. So take it away.
Thanks very much, Anna. Hi, everyone. My name is Dan. I'm excited to share with you the results of a few projects today, and I'll be presenting this on behalf of our research team. Advance, please. The first study I'd like to talk about seeks to understand the effect of ETI, elexacaftor, tezacaftor, ivacaftor on sinus disease. We conducted a prospective observational study of adults over the age of 18 who started ETI, and individuals were enrolled from a single center, National Jewish Health in Denver. People who participated had either 2 copies of F508 or 1 copy of F508 and a minimal function mutation. And the length of our study was 6 months, similar to Anna's study. Our primary outcome measure was change in sinus CT scan inflammation. We'll talk about that in a little bit more. And our secondary outcome measures were change in sinus symptoms or sinus quality of life, change in generalized quality of life, and we used a measure called health utility value to estimate that, and then change in sense of smell. And we obtained our outcome measures at baseline and after 6 months of therapy. Next slide, please. Overall, 30 people initially enrolled in the study and 25 people completed the study. The 25 who completed the study were similar to the 5 who did not. We had a small delay related to COVID, and the mean time of our second visit was just over 6.5 months. Adherence, or how often ETI was taken, was high in the study, over 93% over the course of the study, and medications outside of ETI were stable over the study period. When we look at the population that was enrolled, we see that the mean age was around 34 years. About 2/3 of people were female. 60% of people had 2 copies of F508, and the mean percent of FEV1 was 67%. Many people in the study had a significant sinus history, and 80% of people, as shown in the last line, had undergone prior sinus surgery. Next slide, please. Our primary outcome, what we were hoping to see, was a change in sinus CT inflammation that occurred after starting ETI. And to do this, we used a machine learning-based algorithm. I'll take you through a bit about how this happened. The image on the left is an image in a vertical plane, or sort of we call a coronal slice, of someone who does not have sinus disease. So you see the brain, the 2 eyes, and the sinuses are the area in the middle that's filled with black. Black is representative of air on a CT scan like this. We can then apply a machine learning-based algorithm that was led by Dr. Humphreys at National Jewish, and this algorithm helps specify the area on the sinus CT scan that is actually the sinuses. And in the middle image here, this is shown in the green highlight. We can then apply this algorithm to many consecutive, very thin sinus CT slices, and we can generate a 3D region of what someone's sinuses look like. And this is shown on the third image, the image on the right. We then apply a different algorithm, and we can calculate what fraction of this or what percentage of this sinus region is opacified, and it lets us precisely identify how much inflammation someone has in their sinuses. Advance, please. This is what we did in our study of 25 individuals. So looking now at the images on the right side of the screen, the baseline, the leftmost column is baseline images, that is sinus CT scans that were obtained before people started ETI. And the rightmost column, labeled follow-up, are images that were obtained after people were on ETI for 6 months. There are several different images in the horizontal and then vertical planes, and the red boxes highlight different sinuses or different areas that improved. And if you track back and forth between the baseline and follow-up scans, you can see that there was significant improvement in sinus CT scan inflammation after starting ETI. Overall, for the cohort, there was a significant improvement of about 23% after 6 months of ETI. Next slide, please. We then sought to look at different factors that might affect improvement in change in sinus CT scans. The graph on the right here shows an individual line that represents one individual who participated in the study. And the vertical axis, the y-axis, shows how much inflammation was present on the sinus CT scan using the machine learning algorithm we discussed in the prior slide. What this shows is that people who had both 2 copies of F508 and people who had 1 copy of F508 and a minimal function mutation improved. We looked at other factors that might be associated with improvement, and it turns out that people who were on prior modulator therapy, as well as people who had undergone prior sinus surgery, also had improvement after starting ETI. In addition, we used a second means of analyzing the sinus CT scans called the Lund-Mackay score, and these results were consistent with the machine learning approach and showed that there was improvement across a variety of factors for the entire cohort. Next slide, please. We then looked at various measures of quality of life and symptoms to see how ETI impacted these. The first measure, which is represented in the graph on the top right, uses the SNOT-22 score. This is the score that Anna mentioned that looks specifically at sinus symptoms. Here, higher scores are representative of worse sinus symptoms. And we can see that after starting ETI, there was an improvement in sinus symptoms that started by 1 month and lasted for the 6-month duration of the study. We used another measure called health utility value to look at generalized quality of life. Health utility is not specific to any one disease, but can be used between diseases or to look at different treatments within the same disease. So you could compare the quality of life of someone with CF to a different disease if one wanted to. And the graph on the bottom right, we see health utility value, and here lower values are representative of worse symptoms, worse quality of life. And so we see similar results to this SNOT-22 score, that after starting ETI, there was an improvement in health utility by 1 month, and this persisted for 6 months. In addition, we looked at several measures of productivity loss. Some examples of this are time missed from work or school due to CF, or decreased performance at work or school due to CF, and these also improved after starting ETI, which is exciting. Next slide, please. In addition, we looked at sense of smell. We used 3 different measures to do this. The most established method is represented in the graph on the top right, and this is the same test that Anna's team used. This is a scratch and sniff test that identifies how accurately an individual can smell. And here a higher score is representative of a better ability, better sense of smell. Surprisingly, there was no improvement in sense of smell with this measure over the course of the study. In addition to this most established method, we use some complementary measures to look at sense of smell. One's a survey related to quality of life and sense of smell, and one is a measure that we calculate from sinus CT scans, where we look at inflammation at the top part of the nose before the smell nerve, or at the start of the smell nerve before it transmits a signal to the brain. So there was no meaningful improvement in any of these measures after starting or after being on ETI for 6 months, which was surprising. Next slide, please. So in summary, these data show that ETI improves sinus CT inflammation and sinus symptoms. The improvement in symptoms starts by 1 month and is sustained for 6 months. And there's no improvement or no apparent improvement in sense of smell. These results are consistent across 2 independent studies, our work and Anna's group's work, and 2 independent cohorts. We have ongoing study in progress. One part of this includes looking at cellular changes and RNA expression changes from some cells taken from the nose after people have been on ETI. And this is work led by Dr. Glatter, and she'll be presenting this at NACFC this fall. We also have a longer duration study ongoing where we're tracking the individuals in this study for 2 years, and we look forward to sharing that data with you in the future. In general, these results are exciting, and it's likely that people on ETI have less severe sinus disease moving forwards. Advance, please. This is particularly exciting because sinus surgery, which is something that I do commonly, will hopefully be less necessary for individuals with CF. As Eliza mentioned in her introduction, she's undergone 13 sinus surgeries over 3 decades, and that's a lot of sinus surgery. So it's exciting that ETI looks to be associated with less severe sinus disease, which will likely decrease the need for sinus surgery moving forward. Prior to ETI and highly effective modulator therapy being widely available, we know that sinus surgery improves sinus symptoms, but there was no clear answer as to if this treatment improved lung function, which is very important, to know. So we have an ongoing study to assess the effects of sinus surgery in this new era of widely available, highly effective modulator therapy. This was a project that originated after we communicated with many people with CF and assessed the preferences surrounding their reasons for seeking treatment of sinus disease, the most common of which were lung function and then quality of life, followed by some others. Next slide, please. So the goal of this study is to investigate the effect of sinus surgery on lung function, sinus symptoms, sense of smell, the nasal microbiome, and other factors, while accounting for the impact of modulator therapy. To do this, we're conducting a prospective multi-center observational study. In this study, we look at two different groups of people, both people who are about to undergo sinus surgery and people who are people who are considering sinus surgery but choose not to undergo it. This is not a randomized trial. There's no randomization. So people who are involved in this study select their own treatment, either sinus surgery or no sinus surgery, and we observe them over time. Currently, we're enrolling from 5 centers across the country. If you are affiliated with the center or have any interest in collaborating or participating in the center, please feel free to email me. My email is listed there, or any of the research coordinators at these sites. Next slide, please. We're excited to talk about to share with you the upcoming CFF otolaryngology clinical care guidelines. These are scheduled to be published later this year. This has been a long-standing multidisciplinary effort. In fact, our first meeting for this project was in 2019, and it was in person. It was before COVID. The team for this project is led by Dr. Adam Kimple and Dr. Brent Senior at the University of North Carolina, and the team involves many people with CF. Eliza Callard is participating, as well as many clinicians in the field and CF researchers. And these guidelines cover topics in adults and kids on ENT or otolaryngology areas such as sinus disease, hearing loss, infection prevention, and voicing. And we anticipate that an update will be sent out via the community voice after these are available later this year. Next slide, please. I wanted to say a big thank you to everyone who's helped with these projects. This starts with the individuals with CF who participate in the studies. Thank you to the CF Foundation for supporting this work. Thank you very much. And to the research team that I'm excited to be a part of. This was a big collaborative effort, and none of this would be possible without the folks here. So thank you all very much. With that, I will pass it back to Eliza, who's going to lead the Q&A section for us.
Hello again. So we have some questions. From people who wrote in ahead of time, and we also have questions that are coming in live. So, and I just wanted to put a real plug in for research, because I really wouldn't be here without it. For studies that I've done for my own, like Trikafta, where it ended up helping me, but also just studies where you're trying to add to the body of knowledge. The more knowledge they have about how CF works, the easier it will be to help fix it. So anyway, that's my little plug. And the CF Foundation maintains a list of going CF research. I think that's right? So you can go to their I think it's sort of an interface and figure out where research near you is happening. So thanks, Anna and Dan. The first question is a pretty simple one, but is important to talk about, which is when does sinus disease first appear, usually in people with CF?
Thanks, Eliza. I think that's a great question. Some of the data out there suggests that sinus symptoms get worse as people get older. However, sinus disease is something that we do think starts early on, perhaps and most likely when someone is in infancy or in early childhood. There's some great literature that comes from a group in Europe that performs sinus MRIs, which don't have any radiation, on many young individuals, young children with cystic fibrosis. And the rates of inflammation in the sinuses on these studies, including in infants and toddlers, was quite high, around or just above 90%. So it does seem like there's some sort of sinus inflammation that's present from a very early stage.
Wow, glad they didn't start my surgeries earlier. We saw, Anna, we saw in your slides the gooey nasal polyp, and somebody is asking, what's the effect of Trikafta on nasal polyps? And it looked pretty clear it was helping, but did you notice that overall?
So within our sample size, it looks like most polyps get better or go away. The limitation on that is still a pretty small study and it's only 6 months. But with the data we have, it looks like Trikafta really helps improve sinus polyps.
Yeah, and so that might help help recurring ones in the future, Trikafta might, or a future modulator. Okay, somebody says, what can people do to preemptively minimize a recurrence of sinus disease following surgical treatment? Is recurrence inevitable?
That's a great question. You know, with CF, there is as Anna eloquently showed us in the introduction, there's an accumulation of thick mucus in the airways, both in the lung and the lower airway and in the upper airway, as many of us know. You know, sinus surgery is intended to sort of open the spaces inside the nose so that the mucus can come out a bit more easily. But there is the recurrence of symptoms often after sinus surgery. So I would say in this situation, it's important to work with your local CF care team and your local ENT. Some things that can be done include using topical therapies such as sinus rinses and other medications. But it really depends on an individual in this situation. The upcoming CFF otolaryngology guidelines also will review a variety of treatment options. And again, these have to be factored in with the CF care team, but it will go over many options for sort of helping people minimize the need for surgery and improve their sinus symptoms.
Okay. Well, somebody's mentioning people who can't take modulators or for some reason they don't work on their genotype. Is there research that you know about that's trying to find a way to help the sinuses without the side effects that modulators cause? Oh, sorry. And are there sinus studies available to people with CF who are not on modulators? I think that's really a question for that interface. But I don't know that there are studies happening. I don't know whether there are studies happening that are specifically for people who can't be on modulators.
Yeah, there is some, I'm aware of some early stage ongoing research that looks at a potential topical treatment that would be focused just on the sinuses, or could be, but that's sort of too early stage at this point to talk much about. So it's certainly an area of need, and there are people that were looking into it.
So somebody's saying they're curious if there have been studies or thoughts on sinus maintenance after Trikafta, and I will admit, possibly my doctor is watching, that I totally stopped doing sinus rinses after Trikafta because it all cleared up and it didn't smell funny and it didn't, it's all those things didn't happen. But that may not be the standard line on it. So I thought I'd check in with you too.
We don't have data yet. These are all excellent questions and very practical questions, but we don't have scientific data yet, meaning studies that can answer that question.
Right.
Hopefully in the future.
Yeah, I'm not recommending people do that. So, okay, what do we have next?
One interesting thing we're hoping, do you mind if I jump in and add to
Yeah, please.
One thing we're trying to look at in our study is to see how much time individuals with CF spend on their treatments before and after starting ETI or Trikafta. So we don't have all the data analyzed yet. Yeah, thank you, Eliza. But we are interested because, treatment burden, as we all know, is a big thing. And if treatment burden can be decreased, that's very helpful. So that's something that we're looking into. Yeah,
good. Pre-Trikafta, I was doing like 5 hours a day of different treatments, and not so much. So have you found that Trikafta affects how frequently someone with CF may need sinus surgery? So I guess that's sort of part of what you've been doing.
That's another great question. We are looking into the rates of sinus surgery after people have started Trikafta. We think we'll have a little bit more data on that to share at our sort of 2-year time point, and we look forward to sharing that with you in the future. But I would say, my guess is that the rates of sinus surgery will decrease. Anna's team study and our team study show that there's a big improvement in sinus disease with Trikafta, and right now bad sinus disease is usually the reason for surgery. So hopefully the rates decrease substantially.
I haven't heard of this before, but is there any interest in performing research on the use of probiotics within the sinuses?
So it's a really interesting idea. I'm going to back up a minute and explain a little bit of the my back thought on it, which may or may not be what the person asking the question was wondering. If you've got a pathogenic, meaning bad set of bacteria growing in your sinuses on that mucosal surface, and you restore CFTR function, it would be great to be able to restore healthy, happy bacteria there. And we don't know yet if the body naturally will restore them, or if using a probiotic, which is a formula that has what we hope are healthy, happy bacteria in it, would improve disease. So we don't know yet. It's a really interesting study. It ends up being a little bit of a tricky study also, because when you go to study probiotics, you have to be sure you actually know what's in it, and that there aren't bacteria that you didn't know and you thought you had other ones. So it's a fascinating question. We just don't have an answer yet.
And all the
Hopefully in
bottles
the
at the
future.
store say, don't worry,
it
it's
would
got 5 bajillion bacteria in it. So yeah, interesting. So this is a good question, Dan, for you and me, which is there a good link or list of treatments available for sinus issues to use as a guide for treatment in our CF clinic? Nasal sinus rinses, sprays, etc. So take it away, Dan.
That is a great question. Thanks for asking that, and thanks for sharing it, Eliza. There are many options available for treatments. I would say this is a good opportunity to talk about the upcoming CFF otolaryngology or ENT clinical care guidelines. Again, this has been a big effort that includes many people with CF, pulmonologists, ENTs, audiologists, and many treatments for sinus disease are covered in this. And the whole team looks forward to sharing the completed document with you, hopefully later this year. Anything to add, Eliza?
Just that it's been really interesting to work on that, and I really appreciate the CF Foundation including patients in the discussion and parents of children with CF. I think, frankly, that we add something. So here's somebody who's discovered that their sinuses are more plugged up after Trikafta. Have you guys experienced that in any of the studies you did? In either of the studies you did?
I've anecdotally heard it, and I can't explain it. It would be it's something I'd love to know more about. But at this point, I don't have a good answer for that, other than I've certainly heard it from more than one person.
That's fascinating.
I too have heard about the effects of ETI or Trikafta on the sinuses waning over time. But that, similar to what Anna mentioned, has been anecdotal reports. And we hope to look at this a bit more with a longer duration study. In our study, there were people who had different degrees of improvement. It looks initially like most people had improvements despite a variety of sort of baseline factors, but it is also still something we're looking into, both from a clinical perspective and again with some sort of cellular data that we hope to work on in the future.
Someone is asking, are you sharing this data with ENTs globally? I was not diagnosed, this is not me, but this person was not diagnosed until 36. Before that, had at least 5 sinus surgeries. None of the ENTs in the US or Germany ever made the connection from sinus issues to CF.
We're excited to have the interest. Thank you very much for the question. I'm not certain of the plans to share this, but I do know, and I think at the end, we might be reminded about the link on YouTube, but this will be recorded and is available on the CFF's YouTube channel for anyone to see. I can say I also have been involved with an individual in the past who had sinus disease treated for a while, years at an outside institution, and then was referred to our institution. And after seeing some certain things on nasal endoscopy, the camera test that Anna talked about in her study, and then talking with the pulmonary team, we were also able to move towards a CF diagnosis. So it is a possible presentation, and hopefully this can be helpful to other folks.
Yeah, and definitely that otolaryngology guidelines, which is coming out later this year, I think. That's going to be on the CFF website. So that'll be available to any doctor, anybody who's needing to learn a little about the connection, and some treatment ideas and stuff. So we have a thing saying, earlier this evening, you mentioned that 100% of CF adults showed sinus disease with imaging, but not everyone complained of sinus disease. It sounds like there is a portion of CF adults who don't realize they have sinus disease. What is leading to this?
So that's a really, that's a really interesting question. And I can conjecture, but I don't actually have data on it. I think part of what might be going on, I think there's a number of things over the years that have contributed to this. One is, and it's hard to get good words for this, you're used to the body you have. And so if the body you have wasn't very good at being able to smell things since you were a little kid, then that's not, that's your normal lived existence. And so I think there's a little bit of that. I think there's a little bit of other things contributing to disease severity, like chronic pain or bad allergies, or changes in the way your nerves and the sensory innervation works. And like some people have more chronic pain type symptoms with similar appearing x-rays than others, or CT scans than others. And we don't understand that really for any disease, CF, not CF. So I think there's a component of that. I think another part of this is we've gotten better treatments for lung disease. It's easier to study and notice the rest of it, which is, thank heavens. So those are my thoughts on that. Some of that's just sort of philosophical. I don't know, Dan, if you have other thoughts as well.
Thanks very much. I fully agree with you. I think that CF is a brutal disease. And I think for a lot of the time, you sort of come to adjust to your current state of living and quality of life. I actually have a specific interest in this. And the term that some behavioral psychologists use is response shift. So people sort of shift their baseline as to what is normal because you've been living with it for years or decades. We actually saw a similar result in some of the smell data that we did in our study, where people had a decreased sense of smell, but they didn't necessarily report it really impacted their quality of life. Probably, or at least I hypothesize, because they have been like that for so long that they just it's become their new normal. A lot of this on my part, admittedly, is conjecture as well, but I agree with your theory, and I think it's worth looking into further.
Yeah, I was quite surprised to discover that I probably don't have a very good sense of smell. I always thought of myself as like somebody, able to, smell different kinds of cheeses and stuff. And it turned out that like, no. So is there any difference in the effectiveness of Trikafta on sinus disease for younger versus older patients? For example, someone who's an older adult and has already had a lot of sinus surgeries.
Our study is small, but we saw the same magnitude of responses in the teenagers, which were mostly fairly young teenagers, like 12 to 14, 12 to 15. as in the older adults. Some of the baseline symptoms were different by age, but the treatment response, at least in our measures, was the same across different age groups.
We also didn't have a very strong effect of age on our results. I do think that particularly as you get towards the younger ages, it's possible that age has something to do with it. Maybe Anna's extension of their study will shed more light onto that. We also have some other questions in this realm, but it remains to be seen. It's a great question. Thanks for bringing it up.
Yeah, I wonder if you're talking about sinus disease actually appearing when babies are born, if someday there will be treatment before it even sort of gets a hold. Somebody's saying, following up on an earlier topic, to what degree does Trikafta slow the regrowth of polyps? I think we may have covered that one, but.
I think we're going to need longer duration studies to answer this, because this is a longer process than our data set at this point. So it looks like it slows it, but I can't tell you how much.
Yeah. Can you elaborate on how, sort of, what is known about sinus issues correlating to lung issues?
So a lot of this is from studies that aren't perfect, but that's okay. Like, you start with something that's not perfect. So this is data from Dr. Jen Bomberger's lab, who's also at University of Pittsburgh. They did a longitudinal study observational study of adults with CF and sinus disease to see the interaction between viral infections and the microbiome. But from that data set, we looked and saw if somebody came in for a sick visit because of their sinuses, how did that change the odds of them being started on antibiotics for the lungs at their next pulmonary visit? And having a sinus exacerbation, that study increased the odds of having a pulmonary exacerbation. So that suggests that they're connected. This ends up being a little bit of a complicated question to study, because on the doctor side, you might think, well, there's also the issue of who gets referred to ENT and when, so who comes to treatment and when. And there's some practice patterns where we can't figure out what else to do to get your PFTs up. Well, maybe if we treat your sinuses. So you have another like treatment bias, indication bias, that makes some of these studies a little bit harder to do without doing prospective work. You certainly see it anecdotally talking to people that their sinuses, when their sinuses are bad, the breathing's bad or getting worse. And that's across a variety of lung diseases, even beyond CF.
Yeah, I would say, anecdotally speaking for myself, I even have a phrase for it, which is, did that sinus infection go south for the winter? Because they often do. So do you know any research that there is around how allergies might exacerbate sinus disease? I'm going to take that as a no.
I don't know of any specific studies looking at that. It is a great question. Allergies are covered, or at least there is some coverage of allergies in the upcoming otolaryngology guidelines, and it is, well, we'll leave the guidelines for themselves, but that topic is covered and some potential treatments for that in the guidelines. Okay, great.
And somebody's asking, has iodine been looked at for use as in sinus rinse? Sometimes it feels like they'll throw everything in the kitchen sink in the sinus rinse to see what works.
Yeah, you want to do anything you can to try to improve the inflammation and have people feel better. Yeah. I am not that familiar with any reports on iodine.
Gotcha. I was told, and I will not say from whom, that I should put Johnson & Johnson's baby shampoo in my sinus rinse, which helps make my sinus cilia as if they are fresh from the beauty parlor. So yeah, okay. Somebody is asking, how do you properly clean nasal rinse bottles?
So it is important to use clean water, distilled water, or boiled and then cooled water when you use the nasal rinses. There are instructions in the package and by the CDC. To clean the bottle, it's good to use a clean bottle, and most people just sort of wash that with soap and water and let it dry. And then it is also good to use a new bottle regularly before it accumulates too much bacteria.
I used to think of it as one sinus bottle per sinus infection. So if it was a month-long sinus infection, then get rid of it after that. But again, anecdotal. Have you had any studies linking CF carriers to advanced sinus disease?
Anna, do you want to take that, or should I?
Go for it.
Thanks. Great question. Very
hard
insightful
pass.
question. So there is some evidence that shows that people, or that concludes that people who are CF carriers may have a higher incidence of sinus disease. And the thought behind this is, if one of your CFTR genes, one of your chloride channels isn't properly functional, could that relate to a lower level of inflammation that's not quite CF, but is sinus disease? There are some sort of challenges with these studies insofar as the people who were recruited to the studies or included in the studies were pulled from populations at sinus or ENT clinics who have pretty severe sinus disease. So it's hard to make a definitive conclusion, but I would say there is some evidence that suggests that to be the case.
Okay. Last question, which gets back to things we were talking about earlier, which is what future research are you excited about for sinus disease and CF? Hear from each of you would be great.
I think that the two things that I wish I knew the answer to on like a science research perspective are what's the relationship between sinus infections and outcomes after lung transplant, especially in people that for various reasons can't take modulators. And the second question is one that I don't think is quite here yet, but I think in 5 years, we're really going to want to know, what is residual sinus disease look like on Trikafta, and what causes it, and how do you treat it? And are there more than one type? Is there more than one type? So those are kind of my two research questions that it'll be interesting.
They're kind of longitudinal, long-term studies. Yeah. I guess everything about Trikafta is, can we get a longer study of how it's going? Sorry. Yeah.
Those are great ideas and great areas to study, and I agree with both of them, particularly looking at the sort of optimal use of Trikafta or modulators in people who've had lung transplant and the effects of that. Also looking at the long-term use, long-term sort of state of affairs, as you mentioned, after someone's been on Trikafta for a few years, what will sinus disease and other extra pulmonary or extra lung sort of presentations of disease beyond the lungs look like? An additional area I'm interested in is sort of what are the earliest stages of sinus disease for very young kids. I was surprised that our findings and also your findings show that there was no improvement in sense of smell. And so part of me wonders, if treatment was started earlier, could sense of smell be restored? There's some studies that show that for pancreas function, there are sort of differential effects based on age. And so I wonder if sinus disease or sense of smell also has that. So that's an area I'm interested in looking into in the future as well.
That's great. Oh, thank you guys so much. And I want to thank the folks at the CFF, Rick and Ali Sue and Genevieve, for helping us put this together. And definitely thank my co-hosts, Anna and Dan. All right, guys. So thank you very much. And thank you all for coming. We do these presentations periodically and try to cover subjects that are of interest to the CF community, and do research. All right. Bye, everybody.